We're working with Flow Navigation Centre in Ninewells Hospital to look at the way that the hospital manages unscheduled care. That's patients turning up at the emergency department. So we're working with NHS Tayside directly and the team up at Ninewells of clinicians, of managers, of data scientists up there who have the raw material that we need to work with. But we've also engaged with designers and game makers in the city, and we're working with them to think about how we tackle this problem from a games design perspective.
Healthcare data is stored in a range of different databases that will cover different departments. So there's the emergency department database, there's the radiology department database, there's the ward database. And so healthcare data is spread through all these different databases, and part of our job has been to gather all that data. We get anonymized patient data, and we can then use that to try to join it all together and create this model, this patient journey that you can see behind me. And that then allows us to then create a simulation based on all that data.
Within Flow, and underneath the game layer, there's a digital twin that is a virtual model of the real-world system that the NHS represents. It's a virtual model of the data that's coming into the game. Digital twins help us model safely in a virtual environment some of the scenarios we've built during the workshop, such as how to handle the winter flu or an extreme heat wave in the future. So scenarios or scenario planning are essentially what-if stories about the future. For the development of the scenarios for A&E, we've come up with a really simple, powerful tool, which is a set of cards that come in 3 parts that enable A&E and consultants and other NHS staff to very simply develop micro-stories about the future. We've developed the cards in 3 sections. They cover what has happened, how people are affected, and what's the decision that they should take as a result.
Anyone who plays Flow is going to really easily be able to identify where the pressures and stresses are within the system that we show to them. I think once we start adding in future scenarios, whether that's climate events or changes in transport, players will really easily be able to connect the dots between the observation of broader patient behaviour within that system and how those stresses are going to become more or less pronounced in future.
When you're having a look at the individual data and understanding patterns and understanding times of the day that patients are presenting, we have heavy volume of senior clinical decision makers that are there, but we don't want the system to be dependent on them always being available at all times, depending on different demand. The Flow Design project allows other clinicians and other people in the system to be able to then understand what those potential clinical decisions would be, to then feel like they can also make those decisions as well, which will then gain the same outcome.
Flow was initiated as a response to an NHS policy and campaign for patients to seek the right care in the right place at the right time. An additional benefit is to be able to show how these changes can cut carbon emissions to improve resource use, which results in a more sustainable NHS. Looking ahead to 2040, Flow could be scaled and adapted across health boards. It can also be used as a training and strategy device, and really what we want to see is it integrated into everyday lives so people can make better decisions about their healthcare choices.